As a fellowship-trained and board-certified micrographic skin cancer surgeon, I have been serving the Blessing community with comprehensive skin cancer treatment since 2018. We perform hundreds of treatments every year and look forward to continuing to provide specialty care to our patients. Micrographic skin cancer surgery, commonly known as Mohs, is specialized skin cancer treatment that allows us to be very accurate and precise with removing skin cancer cells while leaving as many normal cells as possible. This provides two primary benefits for the patient: obtaining the highest cure rate of any skin cancer treatment and allowing us to keep the surgical defect as small as possible, which improves cosmetic outcomes. This video is to provide our patients with the necessary information before undergoing the Mohs procedure. We hope that after viewing this video, our patients are more comfortable and confident to move forward with their skin cancer treatment. A very important component of the Mohs procedure is confirming that we have the correct site. This is done by utilizing pre-biopsy photos so we can accurately mark the surgical site. It is then verified by the patient using a mirror. After the site has been correctly marked, the area is cleaned with an alcohol swab and numbed with a mixture of lidocaine and epinephrine. After the surgical area is adequately numbed, it is prepped with a sterilizing agent, commonly chlorhexidine, before starting surgery. The first stage is taken by carefully removing a layer of skin around and underneath the site at a 45-degree angle to allow for proper processing and assessment of the margin. It is placed in a petri dish and oriented by the surgeon on a map that is transferred to our trained Mohs technicians. The tissue is prepped and inked with a specific color to maintain orientation. After inking, it is embedded in a special medium that can be frozen with liquid nitrogen. This is called a frozen section. Once the specimen is frozen, the technician uses a cryostat to cut very thin sections that are placed on a slide. Then it is run through a stainer and given back to the Mohs surgeon to be read under the microscope. Patients can expect to wait for several hours during this procedure, as it takes ample time to process each piece of tissue and to allow for thorough review of each slide so that we can effectively treat every patient. The Mohs surgeon reviews each section and slide to determine if the skin cancer is still present. If there are cancerous cells in the margin, the map is marked according to where the skin cancer is still positive. If there is no skin cancer present, it is marked as clear. After clearing the margins, the surgeon will discuss closure options for the surgical defect that may include leaving it open to heal or a primary closure with stitches. The surgeon may also discuss a flap or a graft that requires transferring additional tissue to the defect. The nurse will then cover the wound with a special dressing called a pressure bandage and will go over wound care instructions with the patient. The nurse will send you home with a wound care bag with extra supplies, including HIPAA-Fix, which is a special type of tape, a non-adherent dressing, and a packet of Vaseline for wound care. Thank you for watching our video and for choosing our Blessing team for your care. Please contact our office to speak with a member of our team with any questions about this procedure.